Hello, I'm Andrew Bierhals, Vice Chair of Quality and Safety for the Department of Radiology at Washington University School of Medicine. Today, I would like to talk to you a little bit about supply chain disruptions and review some of the techniques and the processes we developed that might be useful to you should supply chain disruptions arise in the future. First and foremost, when thinking about supply chain disruptions, we must be proactive. This means having plans in place should disruptions happen. We have to have good insight into our supply chains. There needs to be communication with your supply chain for them to alert you when supplies are coming low. When these supplies start to get below a critical amount, which you are going to need to determine locally, is when you're going to start invoking some of these processes to minimize waste, as well as enhance the utilization of your current supply chain. In order to do this, you really need to have pre-established teams that work with all aspects of the hospital system, as well as supply chain, including members of the pharmacy, radiology, both the technical and professional side, as well as outpatient clinics, hospitalist medicine, and specialty clinics such as radiation oncology, and lastly, the emergency department. In addition, there needs to be constant communication with the vendors supplying these specific products to understand what their limitations are and other alternative sources of the limited supplies. I would suggest that you have a predetermined team that can be pulled together in a very short period of time, in a couple of days to a week, where these team members can discuss what are the concerns at hand, specifically what are the impacts to patients when it comes to the specific limited device or supply. By coming together as a team, you can really focus on shared decision-making to solve the problems, but more importantly, there will also be an understanding and level setting, so there would be shared expectations as to what should be happening, so there are no surprises for any of the team members. Lastly, we must also consider the patient and the patient impact. When we consider this, we really need to focus on communication to the patient to ensure them that they understand they are getting excellent care, but more importantly, that the hospital system, radiologists, and physicians are providing the best care, as well as have processes so their care will not be delayed or limited. This can be done through communications from the hospital, as well as working with national organizations such as the RSNA or the American College of Radiology. So when we think about supply chain disruptions, most importantly, we need to have a proactive plan that allows us to pull members together quickly to develop local solutions to minimize supply chain disruptions and provide patient care. Thank you, and have a good day.